Colon cancer, a formidable adversary that has haunted humanity for generations, continues to be a pressing concern in the realm of modern healthcare. While it's often associated with the elderly, there's a disconcerting trend emerging: colon cancer is no longer sparing the younger generation. In this exploration, we delve into the reasons behind this disquieting rise in colon cancer rates among younger individuals. Moreover, we'll uncover the critical symptoms of colon cancer that should never be dismissed, as early detection remains our strongest weapon in the battle against this devastating disease. Colon cancer, currently ranking as the third most commonly diagnosed cancer and the second most fatal, poses a multifaceted challenge. Beyond the biological complexities of the disease, a formidable industry has evolved around it, driven by financial interests, misleading advertisements, and a mire of perplexing information that often leaves both patients and healthcare professionals bewildered. One common misconception that shrouds colon cancer is the belief that genetics are the sole determinants of one's risk. While it's true that family history can elevate the risk, accounting for approximately 5 to 10% of cases, the role of lifestyle choices in colon cancer is now gaining prominence. Contemporary research underscores the pivotal impact of diet and lifestyle in not only preventing but potentially reversing this ailment. Foods brimming with antioxidants, for instance, are increasingly acknowledged for their role in combating various chronic conditions. Let's delve into 6 symptoms that you should never ignore, as they could be warning signs of colon cancer. Number 1. Rectal bleeding. Rectal bleeding is the most common warning sign of colon cancer. Dr. Alfred Neugut, a medical oncologist and cancer epidemiologist, emphasizes its significance. If you notice blood on the toilet paper, in the toilet bowl, or mixed with your stool, it's vital to inform your doctor. The color of the blood can vary from bright red to a darker maroon shade. Unlike bleeding caused by hemorrhoids or minor cuts, colon cancer-related bleeding tends to be more significant. Neugut cautions against ignoring rectal bleeding, as it can sometimes occur intermittently, leading individuals to mistakenly believe they are fine until the issue resurfaces. Number 2. Iron deficiency anemia. Colon cancer tumors can bleed, resulting in iron loss from your body. While you may not be aware that you're losing blood, a routine blood test can reveal signs of anemia, which is characterized by insufficient healthy red blood cells. Anemia can be a silent indicator of an underlying problem and should not be ignored. Number 3. Abdominal pain. Abdominal discomfort can signal colon cancer, especially if a tumor is causing a blockage or tearing in the colon. The nature of the pain, whether it's dull or sharp, can vary based on the specific circumstances. Blockages may lead to cramps, and you may also experience nausea, vomiting, and abdominal distension. Number 4. Narrow stools. A noticeable change in your stool caliber, particularly if your stools become consistently thinner than before, could indicate a colon tumor. It's essential to pay attention to alterations in your bowel habits, including the onset of constipation. Number 5. Unproductive urges for bowel movements. Tenesmus refers to the sensation of needing to empty your bowels, but when you attempt to do so, no stool passes. This frustrating symptom can be associated with a tumor in the rectum. If you repeatedly experience this sensation without relief, it warrants medical attention. Number 6. Unexplained weight loss. Unintentional weight loss is a concerning symptom that should never be ignored, not only in the context of colon cancer but any form of cancer. Even if you seem to be consuming an adequate amount of food, cancer can alter your body's ability to absorb nutrients effectively. This can lead to unexplained weight loss, which is often a red flag for underlying health issues, including colon cancer. Regarding screenings, the American Cancer Society recommends starting at age 45 for individuals at average risk of developing colon cancer. However, if you have a family history of the disease or other risk factors, earlier screening may be necessary. Regular screenings are vital for early detection and improved outcomes. Several factors contribute to this transformation, encompassing dietary choices like excessive consumption of ultra-processed foods, red meats, unhealthy fats, sugar, and excessive sodium. Other risk factors entail constipation, inadequate intestinal flora, chronic inflammation, alcohol consumption, and smoking. To mitigate the risk of colon cancer, adopting a diet rich in anti-inflammatory and antioxidant foods is essential. This includes a colorful array of fruits and vegetables, spices such as turmeric, healthy fats like omega-3s found in fish, avocados, and free-range chicken eggs. Adequate hydration and fiber intake can address constipation and enhance intestinal flora. Furthermore, embracing a holistic lifestyle, characterized by sufficient sleep, regular exercise, and nurturing social connections, can confer additional antioxidant and anti-inflammatory benefits. The appearance of symptoms depends on the size and location of the tumor. Right-sided colon cancer can be more elusive as feces are still liquid at this stage, making it difficult for a tumor to obstruct the intestine unless it's advanced or metastasized. One method of early detection is analyzing stool samples for hidden blood, as tumors often cause bleeding. Colonoscopies are also effective for early detection. Warning signs of colon cancer include chronic bleeding leading to iron deficiency anemia, changes in bowel habits, thinner stool, episodes of diarrhea alternating with constipation, abdominal pain, abdominal swelling, weight loss, fatigue, and other symptoms related to the affected organs. Intestinal polyps are generally benign growths on the intestinal wall, often asymptomatic. They can be detected and removed during a colonoscopy. However, a small percentage of benign polyps can transform into cancer over time. A pivotal tool in the early detection of colon cancer is the colonoscopy, a medical procedure involving the insertion of a camera-equipped tube into the intestine to scrutinize for abnormalities like polyps or tumors. Commencing colonoscopies at the age of 45 or 50 is generally recommended, although those with a family history may necessitate earlier screenings. Despite minimal risks, such as bleeding or injury to the intestinal wall, the procedure is considered safe and can be instrumental in detecting colon cancer in its nascent stages. If you found this information valuable and want to stay informed about important health topics, please take a moment to like and subscribe to our channel. By doing so, you'll ensure that you won't miss any of our daily uploads, where we strive to bring you valuable insights and knowledge to empower your health and well-being.